Welcome to Medical Marijuana and Wellness. Today's topic is anxiety and stress with medical marijuana. Joining me today is Amy Green, an RN and a practitioner at MMTCFL Florida in the Villages. Amy, welcome.
Hey, Mark, it's great to be here again. I'm excited to talk to everybody about anxiety, stress, and how medical cannabis can help them.
And you see a number of patients that actually have this condition in your particular practice, don't you?
Absolutely. One of the most common conditions that patients are qualified for is generalized anxiety disorder, and that can actually cover several different types of anxiety.
Mm-hmm. Well, let's talk about what is anxiety and stress. I know that stress is a physical and mental response to an external source, and I think it goes hand in hand with anxiety.
Absolutely. So anxiety is your response to that stress. Some stress can be beneficial to your body, but anxiety happens when the stress is overwhelming or the stress is escalating to a point where it's uncomfortable.
Mm-hmm. Yeah, and when you take a look at what stress is, it's the symptoms. What happens? How do you know you're stressed? Well, you get your blood pressure increases, you get chest pains. Um, in many cases, like fear, small amounts of stress can actually motivate you. I know that as an athlete, when I played golf, for example, competitively, I would, although I was very stressed out, I kind of use that as a way of motivating myself. And I think that's what's really important. Although you don't want to let it get to the point where it overwhelms you.
Absolutely. And having that differentiation between what is stress and what is anxiety is very important. That way you can sort of categorize, this is a stress response and this stress response is causing my anxiety
Mm-hmm.
to cause me to respond in a certain way. Like what's up here, it might just be that persistent feeling of dread or apprehension, but it can be caused by a lot of different things. Anxiety is not necessarily only caused by stress. It can be exacerbated by genetics, brain chemistry, or lifetime events, such as
Sure.
anything stressful or post-traumatic.
Right. And it's interesting that anxiety is something where people just feel that dread and that apprehension, but it also has a lot of complex factors. I know that it's one of those things that it's hard to exactly nail down, except for saying that you have it. And what's interesting is there's a lot of people worldwide. They say that 264 million people worldwide have anxiety disorder, and 31% of Americans will experience anxiety over their lifetime.
Absolutely. And it's just the first step to being able to treat anxiety is recognizing it.
And that's what's important. I think that if you have the situation, don't think that you're alone. Don't think that you're the only one that's there. There's a lot of people that have it. There's a lot, and it's a condition that is very real. So really pay attention to it and take a look at some of the alternatives. Now, as I mentioned before, stress is a response to situation. Anxiety is reaction to that. But in many cases, it can be used. It can be used. The signs of anxiety, which are worry, fear, and that type of thing, can also be used as a motivator.
It can, yes. So it kind of goes hand in hand with our flight or fight response. So part of that is you have a stress input and your body has to choose how it's going to respond to that.
Mm-hmm.
Are you going to fly away? Are you going to run away? Are you going to have that extra stamina and strength to be able to run away? Are you going to engage and fight? All of those stressors create anxiety, and how that anxiety manifests in people is different for each person. It might be nervousness, it might be worry, it might be fear, but how they how do I say this? How they interpret their anxiety,
right,
is a very personal thing.
Sure. And I learned from a number of my coaches early on how to channel that stress and how to channel that anxiety to be a motivator and to help me perform better. But again, that took some training, and it's something that's not for everybody. But again, if you have a persistent and it's overwhelming, you may have an anxiety disorder, and you may need medical advice for that. That's important to understand.
Absolutely.
Yeah. So let's talk about why cannabis is such a big deal. I know that it's been known that cannabis helps with anxiety and stress. We all have a nervous system, and I think we've all known about our nervous system for a long time. And I tend to look at the nervous system as the cell phone system of the body. It's how the body communicates from one part of the body to another. If we hurt our finger or hurt our knee, the signal travels through your nervous system to your brain and says, "Houston, we have a problem." This is something that we've known about for a long time.
It is. And the nervous system is a very well studied system of the body. It is what coordinates actions and sensory information. So if I stub my toe, it's going to tell the signals are going to travel directly from my toe through my spine and into my brain and start screaming at me that I have just stubbed my toe.
Now, what's fascinating is we've studied the nervous system for a long time, but only since we've been studying cannabis have we discovered the system in our body called the endocannabinoid system, which every mammal has. We have had in our body for a long time. And I tend to look at the endocannabinoid system as a very interesting system where this is the part of the body that helps regulate pain, anxiety, memory, appetite, inflammation. When your body says, "Houston, we have a problem," the question is, what does your body do about it? And what we found out is the body handed it to the endocannabinoid system to really help put us back into a state of balance and a state of homeostasis.
Absolutely. So our body is always trying to reach that state of homeostasis, that state of balance. So if we have a pain response, our body is going to react to that pain response, partly by sending different chemical transmitters throughout the body. And part of that chemical system is the endocannabinoid system. And so our
Mhm.
body is sending cannabinoids throughout the body to deal with those different signals.
Right. And the reason that that's such a big deal is that when your body tries to stay in balance, and again, that's called homeostasis, your body produces endocannabinoids. And so we know that that's how your body manages itself. And we also found out that phytocannabinoids, the cannabinoids produced by the cannabis plant, mimic the phytoendocannabinoids in your body and actually help with those receptors. If your body, for example, I'll take myself as a senior citizen, if I'm not producing as many endocannabinoids as I did when I was younger, or if it takes a while for me to produce them, having some phytocannabinoids in my body helps my body do its job.
Absolutely. So you have to think of the endocannabinoid system. Endo means inside. So this is what's naturally occurring in our body already. And then phytocannabinoids, such as from the cannabis plant, are going to be supplementing that system and that process that our body already has.
Right. And it's interesting that the endocannabinoid system communicates with the nervous system to keep all of these factors in balance. And this was a major breakthrough. It was a major breakthrough to understanding how cannabis helps both not only just anxiety and stress, but how cannabis helps with the body, but also how the body manages itself. Again, this is something that's come up really in the last 20 or 30 years because cannabis is made up of three components of cannabinoids, terpenes, and flavonoids. Amy, what are those?
Sure. So these are going to be the three main components of the cannabis plant. So cannabinoids are going to be the most prevalent compound, and there's a couple that most people are familiar with. That would be THC and CBD. Those are the big ones. And then you have the terpenes. This is what's going to give the cannabis plant its smell and its taste. And then a lot of the beneficial effects of the cannabis plant are actually coming from these terpenes. And then you have the addition of flavonoids. So this is, again, a naturally occurring part of the plant. And this is going to also contribute to smell, taste, and the color of the plant as well. And flavonoids can also provide some anti-inflammatory, antioxidant properties to the cannabis plant.
Right. And all three of these working together, it's interesting that when you have all three of these components of the cannabis plant working together, it creates something called the entourage effect, where the one and one essentially is three, or one and one is actually five, where these effects actually enhance the medical efficacy of the cannabis plant.
Yes, absolutely. So when you put terpenes with cannabinoids, with flavonoids, you have a great synergistic effect between all of those different components.
Right. And it's you can see examples of that. I know one of the examples is if you're trying to dose or if you're taking cannabis, and you're worried about getting too high from the THC, if you take an equal amount of CBD, it helps to lessen that psychoactive effect. And this is where the CBD and the THC work together to be able to really help your body stay in balance.
Absolutely. And I always tell, especially new patients, THC and CBD, they work better together just to enhance the medical benefits of each other.
Right. And of course, terpenes really are the key for the medical value that's out there. And again, all working together really help. What's the question is, does it really work? And I know there's been a lot of research that's out there. And one of the studies says that many of the terpenes in cannabis have anti-anxiety effects. And we've seen that in a number of research studies that are out there.
Absolutely. So when we're looking at individual terpenes, which again are what give cannabis its smell and its taste, generally we're looking at what those terpenes are doing for us. There are specific terpenes that have been shown to provide great anti-anxiety or anxiolytic effects. However, this is still a growing research field. So we always need more research, but this is what we know so far.
Sure. And a lot of folks studying or suffering or looking for relief from PTS or chronic pain have also found that cannabis has helped quite a bit. Again, that anxiety related symptoms when using medical cannabis has really helped quite a bit. There's been other studies out there that show the importance of the endocannabinoid system.
Absolutely. So when we look at keeping our body in homeostasis, in that nice balance, this is where the endocannabinoid system really comes in. It's playing a role in regulating anxiety, fear, and our behavioral responses to stressful stimuli.
Right. And there was a recent 2020 study that showed how one of the endocannabinoids, 2-AG, has really been able to help a lot with anxiety-inducing connections between really with functions going on in our brain. Again, this is being very well studied, and there's not a lot of research that's out there. We kind of know now that research is really proven that anxiety and stress can be addressed by cannabis. And I should point out, most of those studies are done outside of the United States because here in the United States, it's a Schedule I drug. So these studies are coming from Israel, they're coming from Canada, they're coming from Europe mainly.
Absolutely. And the US, until they change their federal drug policy, that's kind of the way it's going to remain.
Right. But I think it's important to point out, if an apple falls to the ground in Israel or in Canada, it'll fall to the ground here in the United States. So we know the research actually works. So, Amy, when you take a look at CBD and THC with respect to anxiety and stress, it's interesting the amount of, for example, THC that you take is a real factor. In lower amounts, it really works. And when you take too much of it, it actually causes the opposite effect.
Absolutely. It's what's called a paradoxical effect. And it means that the expected outcome is not necessarily what happens. And I usually let patients know that this is very, very dose related.
Mm-hmm.
So I'm sure a lot of people have heard the trope that sativa flower causes anxiety. I usually try and tell patients that's not necessarily the case. It's usually going to be a dose related issue.
Right.
Because if you do find a low dose that's giving you the effects that you want without unwanted side effects, you found your sweet spot. That might be a low dose, and that's
Right.
okay.
Right. And really, in this particular case, more is not better, especially with THC. There's a point at which THC, you get to that, you say that therapeutic level of relief. And if you take a little bit more, it actually worsens it. And you really want to back down. And finding that particular therapeutic level is really, really important. And that's really kind of the opposite of what happens with CBD, because if you take higher doses of CBD, that will actually help reduce anxiety. So, Amy, when it comes to anxiety and stress and looking at CBD and THC, higher doses of THC really can help reduce anxiety in lower doses. But when you get to higher doses, it can actually have the opposite effect. I think this is a case where more is not necessarily better.
Yeah, and I would absolutely agree with you. At a low dose, THC can absolutely help reduce anxiety. But a lot of patients find as they are increasing their dose of THC, especially if you're using a product like flower and you're not controlling your dose necessarily as closely as if you're using a product like a tincture or an edible, you can absolutely have that THC induced anxiety. It's just something that happens to some people at higher doses.
Right. And you really got to be careful of edibles because a lot of edibles on the market today are almost all THC. And so when if you're taking some THC, hopefully to try to address your anxiety, you should really cut that an edible in half initially, start low and go slow because you don't want to have the opposite effect happen.
Certainly. And we actually recommend patients usually cut their edibles in quarters to start at a very low dose and then gradually work up to a dose that's providing the relief that they're looking for without unwanted side effects. And that unwanted side effect could be anxiety. It could be feeling stoned or heady. It can just be feeling uncomfortable. We don't want them to get to that point. And so a low dose product is usually the way to go, and it's definitely the way to start.
Yeah, and we know that you need some THC to be able to address the anxiety and that you have in your body. Now, CBD is just the opposite. More CBD will actually help reduce anxiety.
Yes, and this is an interesting thing with CBD. Because there are no psychoactive effects, you can take a larger dose without the worry of it causing anxiety.
Mm-hmm. It's really there. So when you take a look at cannabis as a product or as something that you can look from a medicine standpoint, I tend to look at cannabis as being a whole medicine cabinet. There's 450 medical properties that we found in cannabis, 120 cannabinoids that we know of, although that they're being studied, and 100 terpenes that are being studied. Again, all of those bring that entourage effect back to be able to help you have all those work together to help you address your particular situation, in this case, anxiety and stress.
Absolutely. And we are still just learning more about this plant every day, and I'm excited for more research to come down about it.
Right. And it really is a whole medicine cabinet. I don't think there's any other product out there or any other plant out there that has the medical benefits of cannabis. We talk about CBD. CBD is fascinating in that it addresses both CBD and THC address the CB1 and CB2 receptors. This is for immune system, our peripheral organs, inflammation, immune system. But we also found that CBD has a lot more properties than just that.
Absolutely. And the really neat thing about CBD is that it actually communicates and connects with other receptors in the body, including the 5-HT receptor, which is responsible for your serotonin. And then you have your A2A, which is part of your body's inflammation and coronary circulation responses. VR1, which helps regulate your body temperature and your pain responses. And then your GRP55, which helps regulate blood pressure. And when you have CBD interacting with all of these things, it's helping, again, to bring your body back into that state of homeostasis.
Right. And again, as we get older, we don't necessarily produce enough cannabinoids to give your body the resources it needs to address your anxiety, for example. Or it takes a while for it to be produced, and which is something where you need the question is for quick response. What are we going to do now? One of the questions everybody has is, I've got anti-anxiety medication. Will it conflict with cannabis?
Yeah. So the recommendation that I always give is anytime you start a new medication, and that does include medical marijuana, that you're open and honest with your physician about all of the medications that you're taking. That way, they're going to have a complete picture of all of the products that you're taking and that are going into your body and how they might react.
But I think overall, you can pretty much say that cannabis really isn't going to have a negative effect when using it with other medications. But in many cases, what you want to do is cut down the other medications that you're using. Don't stop cold turkey, but you can hopefully see yourself weaning off of them.
Yes, and that should always be done under the direction and care of a healthcare practitioner. Anytime that you're thinking about reducing or stopping a medication, you always need to let your doctor know. For the most part, cannabis is very safe with other medications. There are only a couple of medications that it may interact with, and those are actually blood pressure or platelet medications. So very specific. I would usually recommend that when a patient is starting a new product, say if they're using Xanax or Ambien, that they want to start at an extremely low dose of medical marijuana, and then see how their body is reacting with both of those substances together.
Right. And there's many people that do take those medications and cannabis, but again, it's to go low and go slow to make sure that your body not only can adjust to it, but you're getting the right levels of medication to address your particular situation.
Absolutely.
Now, you talked earlier about CBD and THC or Delta 9. Tell me a little bit about the characteristics of those products
Sure.
or those
So-
cannabinoids.
Sure. So CBD is the non-psychoactive part of the cannabis plant. It is found in cannabis, it is found in hemp, and it is non-psychoactive. It mainly targets the CB2 receptors. However, we just talked about all of the other receptors that it connects to as well.
Mhm.
And this is kind of different from THC or Delta 9 THC. This is also found in the cannabis plant, and it can only be found in hemp in quantities of less than 0.3%. The big
In fact,
thing
I think the
with,
definition of hemp is a product that has 0.3% THC or less.
yes, exactly. And then the big thing with THC is it is psychoactive, so it may produce psychoactive effects for the patient. Now, the primary receptor that THC interacts with is the CB1 receptor, but it can have some interactions with other receptors as well.
And that CB1 receptor is primarily in the brain and in the central nervous system, hence why it can generate or can cause a psychoactive response to that. But we talked earlier about cannabinoids working together, and we talked about the entourage effect. This is a pretty good example of where you can take, for example, if you look at just pain, and you can see where the different receptors, different cannabinoids working together can be able to help address things like pain, sleep, inflammation, and cancer. This is a pretty good example of that, where everything working together, 1 and 1 is really 3.
Absolutely. And especially when you consider minor cannabinoids, so cannabinoids that might not appear in such large quantities as CBD or THC, these minor cannabinoids have a very powerful effect on the body. And even in small quantities, they're still very effective.
Right. And, it's not necessarily how much, it's the fact that it's there that makes a big difference, that really helps quite a bit. We talked earlier about how terpenes really are the key to the medical properties of cannabis. And these are some examples of terpenes and how they can help with anxiety and stress.
Absolutely. So, I mean, you'll have the really popular ones like limonene, pinene, linalool, and myrcene. These all have the ability to help relieve stress and anxiety. Another really big one is beta carotene. All of those terpenes are going to be major terpenes. So they usually appear in larger quantities than some of the minor terpenes. So
Mhm.
these are the real powerhouses of the terpenes.
And I think when you're looking for a cannabis product to address anxiety and stress, one of the things you should ask the dispensary, the person, people that you're working with is, what are the quantities of these particular terpenes? Look for these terpenes to address anxiety and stress. I know I've talked to patients that say, well, I tried cannabis and it didn't work. Well, when I go back and look at the product and I match it against their particular condition, sometimes the symptoms and what they're trying to address doesn't match up with the benefits of the terpene.
Absolutely. And this is why asking the person who is helping you at the counter, asking them for a certificate of analysis or a COA can be very helpful, because that's going to give you the specific breakdown of terpenes in that specific product.
Sure. And that's how it's kind of interesting. When I first got into medical cannabis, I would go into the dispensary and I would see a lot of different products. And I was wondering how that person knew what would work for me. And it was because they were matching the terpene profile to my particular condition. Now, terpenes are interesting in that they are very sensitive to heat. And I say that because there's a lot of folks that'll say, well, I'll just smoke a joint and it'll take care of it. And what's fascinating is when you put that 500-degree temperature up to a joint, you're burning off half of the cannabinoids, almost all the terpenes and all the flavonoids. It's key to be able to have a product, especially if you're looking at a vape type product, that has a temperature setting so that you can set the appropriate temperature for the targeted terpenes that you're looking for.
Absolutely. And this is really going to take some trial and error to figure out what temperature range best works for the conditions that you're trying to treat.
Mhm.
But I always recommend starting at medium. And then if you need to go higher or lower, you can do that. But medium is going to give you a good access to all of the available cannabinoids, but it's going to give you access to a lot of the terpenes as well.
And I think it's important to point out that if you have a vape pen that has a temperature setting that could be low, medium, and high, or some of them actually have 4 temperature settings. Um, that you say that one that keeps it in the range that's below 350, the first setting or the second setting is really the ones that you're really looking for anxiety and stress. When you take a look at terpenes in other products, they actually have a terpene profile where they've been produced at those temperature ranges to bring the benefits out of those particular terpenes.
Absolutely. And this also applies not just to vapes in the classical sense, which you would see like cannabis oil connected to a battery and you have a vape. This can also work when you're using what's called a dry herb vape as well,
Mhm.
which is a product that you would use with flour.
Right, right. And it's very, very important. Let's talk about the different cultivars. Now, what is a cultivar? What's happened in the last 5 or 6 years is a lot of the people that are producing cannabis are starting to produce products that really target particular conditions. And when you take a look at the terpene profile and the strains together targeting a condition, they call that a cultivar. And we used to use the word strains quite a bit, but really it's more than just strains. It's the strains and the terpenes together that produce the profile that's out there. So if you take a look at some of the cultivars that address anxiety and stress, you'll see a very, very common terpene profile that with myrcene, pinene, caryophyllene, limonene, that type of thing.
Absolutely. And once you know what terpenes you want to use or what terpenes you want to be the majority of the product that you're using, then you can start looking at THC content.
Mhm.
Like some of these are CBD dominant or they're a balance of THC and CBD, which can be really great for newer patients if they're worried about getting that high heady feeling. Using a balanced or a CBD dominant strain can be really beneficial.
Right. Now, I've highlighted pinene here, and the reason for that is pinene is really great for anxiety and stress. However, pinene also brings back short-term memory. And I know if you're one of your conditions that you're trying to address is PTS, you really want to pay attention to pinene because that may cause the opposite effect of what you want to have happen. Let's talk about how to take the product because we touched on it just shortly a little while ago. One of the ways people start is with sublinguals, and again, be very careful because there's a lot of sublingual drops out on the market today that don't have terpene profiles.
Yes, and this is why it's really important to get your medication from a trusted dispensary, and they should be able to provide you with that COA, that certificate of analysis, that's
Mhm.
showing you exactly what the terpene profile is for that particular product.
Yeah, and one of my favorite dispensaries, which is Surterra Wellness, they'll actually tell you the actual terpenes that are in their sublingual drops. And I know that when my wife was trying to take some of the sublingual drops, we were addressing her anxiety and stress. We tried another dispensary that did not have any terpenes in their sublingual drops and didn't work for her. And we found that by being able to find not only the right tincture drops, but the right terpene profile made a huge difference. It really brought her the relief she was looking for.
Absolutely. And that is part of the journey is finding that specific product that works really well for you.
Right. And these sublingual drops and sprays, they usually take 15 to 20 minutes to work, and they'll last anywhere from 4 to 6 hours. So it's something, for example, when I wake up in the morning, I'm addressing pain, addressing inflammation, which can bring anxiety and stress in higher levels. Um, I tend to use a sublingual drop in the morning to really take me through the morning, and then I use sublingual drops in the afternoon to be able to take me through the afternoon. Then I do it again in the evening because, again, I have that 6 hours, 6 hours, and 6 hours. My herniated discs in my neck aren't going to go away. So I've got to address them during the day to be able to keep them in check and keep them with a pain level below a 1. And that's really, really important is how often you take it. And sublinguals are kind of interesting because they really absorb into the blood vessels of your mouth. But a lot of folks you hear about edibles and capsules. It's a very big difference because in edibles and capsules, they take anywhere between 15 minutes to 2 hours to work, but they will last up to 10 hours. And that's really an important aspect, especially in the evenings when you want to sleep through the night. Something where like a gummy in the evening will help you sleep through the night, where a sublingual may not.
Absolutely. And having a little bit longer onset time for those products, you always just want to be careful that you're waiting long enough before you take any more.
Right. I mean, there's a famous saying that about the time you think it's not working is the time it starts working. And I always what I like is because, again, I'm trying to address, in my case, herniated disc. Topicals work great, especially transdermal topicals.
Absolutely. And the nice thing about most topicals on the market is that they're going to be just localized relief to wherever you put it. So you wake up, your knee hurts, put some on your knee. It's only going to help your knee, and it's not going to give you that high, heady feeling or any systemic effect throughout your body. It's just going to be localized to wherever you put it.
Yeah. And when you rub on the topicals, they last a couple of hours. Although there are patches that are out there that'll last sometimes up to 3 days. It depends on the product itself. It does what they call microdosing. It lets a little bit of cannabis out as you go during the day, and that's very, very effective. Now, let's talk about inhalation for a second, because this is what we talked about earlier. Flower, is very effective, but again, if you try to burn off all the medical properties of it, it doesn't help very much, and that's why they talk about vape pens and concentrates.
Absolutely. And like we said before, really look into, if flower is something you want to use, look into a dry herb vape. It's just going to give you a lot more control over the temperature and really how much product you're using, because you're controlling the temperature so closely.
Yeah, and you can get a lot of those products from the dispensary themselves. They carry a number of different products that are out there, and I highly recommend that you invest in one, because the relief that you get is tremendous. It makes a big difference. And again, also take a look at potentially matching, the sublinguals, the oral, the topical, and the inhalation based on what you wanted to cover during the day. I know I just finished doing some serious physical exercise, meaning called moving, and the topicals became a very important part of my life at that point in time. So let's talk a little bit about wrapping this up. We have talked about anxiety and stress. We've talked about how medical cannabis can help. I also want to point out there's a website called igmlb.com, igotmylifeback.com, that if you have a medical cannabis story, please go there and share it with us. We'd like to have folks be able to hear about your journey that's out there. And more importantly, what we're trying to do is build a library where you can actually see the effects that people have had using cannabis, not from the scientists, but from people that are actually users that are out there. So that's kind of an important site that's out there. But Amy, let's wrap up a little bit. What's your thoughts on anxiety and stress to wrap up?
So my biggest thing is, of course, start low, go slow. And I really recommend incorporating both CBD and low levels of THC if you're trying to focus on anxiety.
Right. And I think also paying attention to your route of administration is really important, because matching the terpene profile to your particular condition makes a huge difference with cannabis. And I think that's important to make sure you're looking for those myrcene, those linalols, those limonene. They'll help you quite a bit. Those beta caryophyllene, that'll make a big difference in what's there. So Amy, as a wrap up, we know we have this webinar series that we put together, and a series of videos on YouTube that you can learn about how cannabis can help you in general, as well as with your medical conditions. But also, we have the marijuana aware webinars on a weekly basis are something that people can tune into and get their questions answered as well.
Absolutely. And it's a great resource to help you find the products and learn more about the products that can potentially help you.
Right. Well, we hope that this video has helped you address anxiety and stress. Please join us for our webinars, or check us out on social media, our YouTube channel, as well as Facebook. If you have any questions or comments, please email us at events@marijuanaaware.com. Thank you very much for watching, and we look forward to your comments.